All right, welcome to those who are viewing this live streamed on Facebook. I have not started recording yet. All right. Thank you for your patience here. I'm going to get this set up. So in just a moment, I am going to start recording. Gosh, if you hear a noise in the background, it is my refrigerator. I am at home tonight because my art therapy studio had broken air conditioning this week. I've gotten word that it is fixed now, but I was already at home. So here we are with my loud refrigerator. So hopefully that is not a distraction. All right, I'm going to go ahead and record and we'll get started. I'm excited about this. Okay. All right, welcome to advanced session 3 of the redefined process, body signals. So I'm really excited about tonight's teaching because we're going to get into just a little bit, just kind of scratching the surface of this topic of the mind-body connection and how our body really gives us signals. It gives us warning signs about our feelings, about trauma triggers, about things that are coming up for us that need to be addressed. So we can really, by learning to pay attention to these signals that our body gives us, we can learn to notice patterns and then address those patterns, address those emotions, because we've noticed over time what our body is trying to tell us, literally through signaling us, through giving us warning signs. I'm probably going to be drinking water a lot. My throat, my mouth is real dry today, so bear with me with that. Okay, so advanced session 3, body signals. Let's see, will it advance? Yes, here we go. Okay, so what we're going to be talking about in tonight's training. So I'm going to go over just a real broad, high-level overview of trauma and the mind-body connection. I'm assuming most of you, if you've made it here, you've done some trauma therapy work, you have some understanding of this, but we're just going to do kind of a review of that basic concept of the mind-body connection and trauma. We're going to talk some about art therapy and trauma, which for most of you, unless you've heard me talk about some of these things in other trainings, other videos, that's going to be new for you. And I'm excited to share that with you because I think even though we're not doing art therapy per se in this program, you are learning a lot of art therapy techniques. And I really enjoy teaching about the rationale behind what I do. And so I think this is going to really enlighten you and just help inform kind of your process as you're going through the tasks in the redefined process, that you'll understand more what's behind it. So I'm excited to share that. And then we're going to get into the actual body signals art exercise. I'll give you those directions. And I don't have any images to share tonight. What I'm going to do is I'll stop my screen share and just show you live, which I think will be more helpful, how to do the activities. Okay. So, all right. So trauma and the mind-body connection. So as I'm sure you already know, trauma and emotions are stored in our body. They're stored deep in our nervous system. So our brain and our nervous system control everything else, right? And so when we've experienced a traumatic event, or just any emotions we have, but in particular, we're talking about trauma right now. There are emotions related to that, and that is stored in our nervous system. And what I mean by that is it's both stored kind of deep in our brain and possibly a lot of times in our subconscious brain, and also in our physical bodies as far as like how our bodies feel. So of course we're all familiar with the idea of like with PTSD, if you think about classic examples of like soldiers who have been, in war and they have experienced a trigger, now that they're out of that situation, right? They're not in that traumatic, dangerous situation anymore, but they might hear a gunshot or another loud noise. They have a startle response in their body, and they might have a flashback memory to being in war, to being in, in this battle with gunfire where their safety, their life was in danger. And then they go their body reacts and goes right back to that situation as if they were in danger. Sometimes they may not even know that they're physically present here. They think they're back in that place. Okay. So So I like to give that extreme example because it helps us understand, but really, it's that same thing going on with us who are survivors of emotional abuse when we experience some sort of trigger. So that can be a sound, a smell, an email, or other message from the abusive person. It could be seeing a person that we that knows them, like somebody that you were mutual friends with when you were in the relationship with the narcissist. It could be going to a particular place that reminds you of them, right? So there's so many things that can trigger these memories. And so some of it is, it's stored in our subconscious brain, or, in our brain, and it comes out as a memory or a thought that is more subconscious once it's triggered, if that makes sense. And sometimes it comes out through our physical body, through our health. So my second bullet point here, trauma can affect our physical health in the form of illness, fatigue, stiff muscles, sore joints, even chronic illnesses like cancer. And I want to be careful here because I don't want to sound like I'm suggesting that things as serious as cancer are always caused by emotions. There are a million different causes for those things, but we know that stress and trauma, there's a lot of research on this. It manifests in our bodies in physical illness. And I'm also not saying that it's like a pretend illness, like you just think you feel sick because of your emotions. No, I'm saying it literally manifests as physical illness. For example, most of us are familiar with the concept that if we like stress can cause an ulcer, right? That's a real physical condition. Stress can cause muscle pain, joint weakness. It can cause fatigue. One symptom that I've had ongoing for many years is fatigue, a sense of heaviness in my body. And, sometimes that's actual fatigue. Sometimes the heaviness in my body is related to real things going on with my muscles, like I strained myself, overworked myself. But oftentimes I've found that it's related to trauma, and I've gotten really familiar again with these signals that my body tells me of when it's trauma and when it's not, down to where I can sort of filter through. Like if I'm like, I'll tell a quick story here. Recently, I got back into the practice of doing some yoga at home, some short yoga videos, like 10-minute yoga in the morning. And it had been a while since I'd done it, and I was experiencing a heaviness in my body after doing the yoga that I knew was the trauma heaviness. It reminded me of like an extreme example of when I used to feel this was when I would get an email from my abusive ex related to co-parenting situations. And I would feel a physical weight wash over my body. So down from my head down to my shoulders, especially, like a heaviness all over my body. And I felt fatigued as a part of that. My whole body felt heavy. I can just really like imagine it right now. And so when I got back into doing the yoga recently, I noticed that I was having a little bit of this heavy feeling, not that strong, but it was after I did the yoga. And I knew right away I could differentiate that heavy feeling from just my tired feeling that I didn't get enough sleep. I could differentiate it from just like sore or stiff shoulders that I tend to have, which can be related to stress, but also how you sleep, or, my poor posture, that kind of thing. Which poor posture could also be related to trauma. That's the whole, gets deep, but so I have like a sore hip, like, because I kind of walk weird because of my poor posture and poor alignment. The chiropractor is very important to me in correcting that. But so I could differentiate all these different physical ailments from that heaviness. Like I knew that is separate, and I can identify what that is because I paid attention to that trauma symptom for so long. I know what that is. And I believe that it was coming up after I was doing the yoga. Because through moving my body in these yoga positions, I was actually tapping into some of this trauma that was stored in my body. And I knew that. And because I've experienced the benefits of yoga before where I didn't feel that in my body. So I was like, okay, something's going on with me right now where this is tapping into some trauma that I've got stored, and I don't know how to release that. And so this is a whole topic I didn't think to go on, but I think this is a really helpful story. So I actually was undergoing some coaching at the time, some trauma coaching to deal with some deeper kind of childhood wounds of mine. And so I sent a message to the trauma coach and I said, hey, like I'm experiencing this. I know what this is. Do you have any suggestions of like what to do? Because I thought the yoga was going to release the trauma, but it's really bringing it up in my body. And so, and his response was, if you're kind of in a dissociated state, you're not fully in your body when you go to do the yoga, you're probably not going to experience the benefits of it. So try doing a deeper meditation practice before, which I was doing some short meditation, but I think it wasn't enough to really get in my body. So then I started doing a longer meditation that was a guided meditation from an app so I could really, get into it. And by long, I mean like 10 minutes versus 2 minutes. Okay. So 10 minutes of the meditation that helped me get in my body, to where I wasn't just in my head, dissociated, like thinking of other things. I was in my body, and then doing the yoga after that, then I experienced the benefits. Okay. And again, I don't have the heaviness. I have some other kind of aches and pains and things that are going on for other reasons. But that heavy feeling that I know is my trauma feeling, that is not there if I do the meditation first. Okay. I just think that's a great example of how this can come out through our physical bodies. And there's so many other things I brought up there too, dissociation. There's so many topics here, but we're going to try to focus in on my key points here. So because we know this about the mind-body connection and how trauma and emotions are stored in our nervous system, the most effective trauma treatments are those that address this mind-body connection, right? So there's so many different treatments. One really well-known one is EMDR. It stands for eye movement desensitization. I can't say it all right now. I just blanked on the whole thing, but you can see why it's very long. And so this has to do, just a brief explanation if you're not familiar. I have participated in this as a client. If you haven't, I think you should look into it. It's very effective in dealing with specific traumatic memories or specific feelings in your body related to trauma. So what it is you hone in on a certain memory or a certain feeling in your body, like a pain in your gut or the heaviness in your shoulders or whatever, or a memory of something that happened when your abusive ex, did or said something to you. So you're honing in on that and thinking about that while the therapist, who is trained and certified in EMDR, it's a certain certification. I'm not certified to do it. You have to go to someone who's certified to do that. You're either following their finger or looking at lights buzzing or blinking back and forth, or holding on to buzzers in your hands that they buzz back and forth. And what that is doing is it's activating the two sides of your brain, the right and left side of your brain, as you're processing this memory or this body sensation. And so that literally it rewires your brain, is like the short layman's term way of explaining this, right? It changes that memory or that body, that emotion in your body, the feeling in your body related to the traumatic memory. It helps you integrate it more. So it's not this separate thing that's like a threat to your body, to your brain. It helps you integrate it more into your body. So, and I forgot to mention, so that's one example of a very effective trauma treatment. Art therapy can be effective for reasons I'll get into in the next couple of slides. It's not the same as EMDR, it's different. And there's all different reasons to do each one. Art therapy is expressive, it's creative. You can also talk through it. EMDR, there's not as much of the verbal processing. It's more just the explaining kind of what you saw in your mind when the buzzers were going to the therapist, so even just talk therapy, even though that doesn't, directly address the mind-body connection, there's a place for that in trauma treatment. You need to talk it out. The EMDR is also helpful. Art therapy is expressive. It involves both the verbal and the body movement. And it activates your brain in different ways, which I'll get to in a minute a little bit. So there's lots of different treatment. There's something called brain spotting that I heard about recently, that I actually know someone who's experienced this as a client. And now I'm interested to try it. I won't get into an explanation, but brain spotting, you can Google that as well. It sounds a little woo-woo, but it's based on some similar principles to EMDR. And there's lots of other treatments out there. Somatic experiencing therapy, we're literally kind of the healing touch from the therapist. Like, and again, they're trained in this specific approach where they know kind of how to gently put their hand on your shoulder while you process whatever. I don't know how they do it. I haven't experienced that. I have experienced EMDR and art therapy. This book I'm going to recommend. This is dense, but if you can see it here, The Body Keeps the Score. You may have heard of this. It's very famous. The subtitle is Brain, Mind, and Body in the Healing of Trauma. The Body Keeps the Score. I love this title. Trauma is manifested in your body. And so this is dense. It's by a doctor named Bessel van der Kolk. He's very well known for his trauma research. It's dense, but it explains these concepts in a way that is more accessible to you and me than if we went right to the medical journals and the scientific papers, right? So this is a good in between if you want to get into the research, but you're not going to go like look up the medical journals online yourself, okay? It's all here in this book. So The Body Keeps the Score. Excellent book. I do admit I have not read it cover to cover. I've skipped around and read different parts. It's always on my to-do list to finish reading this book. As a single mom, I don't read a lot of dense books, so I got to make the time for that to happen. I was going to say something else about that, another resource. I'm going to mention, if you're also not familiar with the ACE study, ACE, it stands for Adverse Childhood Experiences. You should also look up the ACE study. That was a study done, which I'm sure it's mentioned in that book, a study done by a couple of doctors that started to notice a pattern in their patients who were experiencing certain illnesses as adults, that they had these adverse childhood experiences, different types of childhood trauma. So they came up with this questionnaire. I believe it's 10. Yeah, it's 10 questions. Have you witnessed domestic violence? You were sexually abused in this way or that way as a child. Your parents were divorced. You had a family member in prison. All of these adverse childhood experiences, some of which are abuse and some of which are just traumatic in other ways, like having a family member in prison is traumatic. That's not direct abuse, but it's traumatic. So you score yourself 1 point for each of these things you've experienced. And there's they've done research to find that the higher your ACE score, like if it's over 4 or 6 or 10, whatever, 10 is the highest if you've experienced all of those things. The higher your ACE score, the more likely you are to suffer from, not only poor mental health as an adult, but also a lot of physical illnesses. Obesity is much more common, and all sorts of other illnesses. And so this isn't to say you're doomed to have those illnesses if you've experienced childhood trauma, if you've had these adverse experiences, but it's to explain like, hey, this is maybe why this is manifesting. These illnesses are manifesting in your body. It's from the trauma that is being stored there. And so you can address both the trauma and the physical conditions. You can address your mental and emotional health along with the medical side of things and heal much more effectively than if you're just addressing the medical physical part. Okay. It's fascinating. If you haven't heard of the ACE study, look that up. Fascinating. I did a training based on that when I worked in the school system for my school staff, and had everybody in the room, the teachers, take the ACE quiz. Yeah, really interesting stuff. So we want to do treatments that address the mind and the body. Okay. So art therapy and trauma. Just a minute. So I'm going to share a lot of background kind of overview, and it's going to lead up to the more practical of how this comes into play in treatment with trauma. Okay. So first, art and play are our very first languages as children. So from the age of, maybe 1.5, like 18 months to 2 years old, children are already playing make-believe. I remember when my daughter first had her little figurines from the Daniel Tiger cartoon, if you're familiar with that. And she had them actually on this very table, our kitchen table, and she was like made one of them knock the other one on the floor. And she was said, uh-oh, boo-boo. And like she was making one of them hit the other one. And that was the first time I really remember seeing her engage in make-believe play. And she was so little, she couldn't even really talk, just uh-oh and boo-boo. And it was cute, but also disturbing, that was the first thing she chose to act out. So at a really young age they do that, and it's playing out things they've seen. Kids at preschool were pushing and biting each other or whatever. She's playing that out. It's natural. It's a natural way for children to process things. Or they play house, even at a very, very young age, because they're acting out kind of what they've seen, the roles they've seen played in the house. They want to cook like mom or dad cooks, that kind of thing. So they play with their toy kitchens, and art is the same way, where, even in cultures, and countries and poverty levels where children do not have access to Crayola crayons, they're going to draw with a stick in the dirt. They're going to make marks and make representations of, again, things they're seeing in their life. And so I want to go quickly through, the stages of graphic development, which is just the stages that we go through, in our development as children, in drawing. Okay. And this is all going to tie together. So yeah, okay, I'll just say that. I'm going to come back to why it's important for us to understand kind of these different stages. So the graphic development corresponds with our cognitive development as we grow. So there's these different stages of cognitive development that are natural and when we develop as children. And so as young toddlers from ages 2 to 4, it might be a little bit before age 2 when kids will first, pick up a marker or crayon and actually make marks with it. But roughly 2 to 4, kids are in what's called the scribble stage. And there's actually 3 different stages to the scribble stage. It's the only stage of graphic development that has sub stages. But you see, the young child in this adorable picture here, it looks like he has oil pastels, which makes me happy. I love oil pastels. This child is scribbling. And so first, before they even get to this stage, I'm sure you all have seen a young toddler, in what's called, what is it? The specific stage called, but it's all about, I looked it up earlier because I don't have my book that talks about it. It's at my studio, but it's all about the kinesthetic movement. So the first scribbling stage is just, they're not even looking at the paper or they're not looking at the dirt when they have the stick. It's all about the movement, right? That sensory, kinesthetic quality of it, of moving that, drawing tool across a surface. Then they get to the point where it's a more focused scribble. So like this child in the picture is looking at the paper and scribbling, right? They're making like curved lines versus just the back and forth, crazy lines, like real fast. And then it moves on to named scribble. So that's where they're still doing the focus scribble. Like this child might be at that stage. They're still doing the focus scribble, but then they'll point and say mama or dog or whatever, like they're saying the scribble represents something. Then after that, ages about 4 to 7, you get to what's called the pre-schematic stage, where they're just starting to make closed shapes. They're starting to make circles. And one of the cutest types of child drawings that I love, where they make the little people, their first people, is a little circle. Well, maybe not little, but a faint kind of, faint little wispy line of a circle, which I think is so cute. And just 2 to 4 sticks, lines coming out of the circle, and that's a person. So it's like the arms and legs just coming out of the head. And that is because at that age, that is their whole like experience of themselves, right? They're egocentric, they're focused on themselves. I have a friend who says that all toddlers are like little narcissists, which she didn't mean that in a mean way. We're actually talking about being triggered by our toddlers, because they're self-focused. And it's like, oh, I'm giving to everyone. Like, if you're a survivor of narcissistic abuse, that can be triggering, and it's not the child's fault. It's just where they are in life, right? They're focused on themselves, and that's healthy and normal. So their people are literally, it's like their head and arms and legs. That's how they're thinking. And there's actually a name for those people. They're called encephalopods, which is a really like technical, weird sounding name for like the cutest type of human drawing. Encephalopods. And at that age, literally, they can't even, if you give a child cut out shapes to make a person, like if you give them like a rectangle for a torso and a cutout circle for a head and sticks for arms and legs, and ask them to like make a person, they actually can't. Cognitively, they can't go there. They'll still make it look kind of like a spider, like they'll put the arms and legs coming out of the head, even if they have the torso, or they won't use the torso, just because their brain can't do that yet. And then And then you move on to age kind of 7 to 8 to 9. They're in the schematic stage where they have a certain schema, a certain symbol in their mind of like, this represents this. So this is where they'll draw, like they'll have their schema for what a girl looks like. It's like the triangle dress and the head and, you know, this is what a girl looks like. This is what a boy looks like. This is what a tree looks like. All my trees look exactly the same, like the lollipop tree with the fluffy, you know, leaves on top, whatever, you know. They have their certain schema and they'll draw things like all lined up on a baseline, like butterfly, boy, girl, tree, house, like it's all lined up. It's so cute. So these are different stages, and it moves on from there to more realistic, you know, adding details. And that graphic development stops around like 12 to 14, unless you participate in you know, more advanced art classes where you learn more techniques. You know, most adults are walking around, they draw like a young teenager, like a 12 to 14-year-old, because that's where our graphic development stops with that. Okay. This was like maybe too technical for you. Maybe you're really interested, but there's a reason I'm sharing this. Okay. This is advanced sessions, advanced teaching. So also, okay. So as art therapists, we can look at, I'm trying to think of how I want to say this. I'm going to do a disclaimer first, that as an art therapist, the primary part of my job is not to look at a client's artwork and interpret it. So I'm not going to look at someone's work and say, you drew an X here, so that means you're having conflict with your spouse. You made a hole in your tree, that's a trauma hole, it means you have trauma. I'm not going to diagnose you with PTSD because of whatever, like in your drawing. It just, but at the same time, there are certain features we can look at in artwork, and it's going to give us information of kind of what avenue to go down, what to question. Those things I mentioned, the X, the trauma hole in a tree, those are actually things that could indicate, you know, like an X in your artwork could indicate conflict. And I noticed that in my own artwork when I'm making X's and I'm like, oh, here are all the X's. And I again, you know, like we always say, it's a no judgment zone in the creative process, in the redefined process. We don't judge what comes up. So I'll notice those X's and I'm like, okay, just go with it. Don't edit them out. Don't judge, because maybe there is conflict here. Maybe there's not, but I just let it go and then reflect on it later with my writing, you know? So it just gives us some possible information. So that's important because of the graphic development, which I'll get back to, but also the types of movements and marks we make can reflect trauma we've experienced. So, or just other sorts of mental health diagnoses that, or symptoms. I'd rather talk about symptoms than a diagnosis. We all have symptoms of different things. So for example, if someone is feeling, if we're feeling depressed, right? Like when I'm feeling depressed, I have low energy in my body, right? So my body is low energy versus when I'm anxious, I might have high energy, or when I'm angry, it's super high energy for me. So when I'm depressed, when I go to the artwork, I'm going to have low energy with that. So it's going to be hard for me to, I'm not going to make dark lines probably. I'm not going to press hard with my crayon or my oil pastel. I'm probably just it's gonna be simple, and I'm not gonna be super engaged. Whereas when I'm angry, I am scribbling with my jumbo crayon and hoping it doesn't break because I'm pressing so hard on that paper, right? So how we make marks, if we're erasing a lot, and just kind of real hesitant to draw, or real sketchy and erasing and hesitant, that could indicate like some low self-esteem, some, you know, we're questioning, we're doubting ourselves, we're feeling nervous or anxious. And most of that's kind of intuitive, you know, I'm sure when I say that, that kind of makes sense to you, right? So those are also things that, those are things that an art therapist can pay attention to. And if you're knowledgeable about this, even on the level that I'm explaining it now, you can kind of pay attention to the energy that you're bringing to the artwork. Now, where this plays into the graphic development, and I probably went into way too much nerdy detail with that for you, but so something also that's interesting is that when I have, let's say, an adult client come to me, let's say I have a 22-year-old young woman come to me, and it's, you know, she seems like typical level of cognitive functioning, right? She's a high functioning young woman. She's in college or has a career, you know, she's, there doesn't seem to be any developmental or cognitive delay. But when she draws, she's not drawing at that 12 to 14 level. Like I said, most adults kind of draw at, but she's drawing like a young child, like maybe a 5 or 6 year old. Then because of my knowledge of graphic development, I can look at that and say, okay, either she has an intellectual and developmental disability, which it doesn't seem like she has based on my interactions already with her, or I can see she's regressed, right? Are we familiar with this concept of regressing? So when we are very emotional, or when we've experienced trauma, we have regressed behavior. So how this plays out in behavior is, okay, a little self-disclosure here. There were points when, especially when my daughter was a younger toddler, she's almost 8 now, but when she was younger, she was very emotionally reactive, and there's a lot to that. We know, children in our situations, can have they have their own trauma, their own emotional issues, right? And so she's very reactive, and she would just scream and scream, and that would be a trauma trigger for me, and it still is, but I manage it much better now. There were times where I found myself yelling back at her, and literally, I mean, this is embarrassing, but it's just the truth, and maybe you can relate to this, like literally jumping up and down and stamping my feet and screaming back at her as if I was a toddler too, as if I was a little kid arguing with her. And I would notice it in the moment that I felt ridiculous. I felt like a kid, but I felt like I couldn't stop it because this trigger was so strong. Like my feeling of lack of control, right? Like my feeling that I didn't have a voice and I needed to make my voice heard, damn it. Like I needed to stomp my feet. That was coming up for me. And it was so bizarre to, in the moment as a therapist, like know what was going on with me, but I couldn't change it in the moment because I was so triggered. So I was regressing, right? I was in my trauma brain. I was regressing because I experienced a trigger. And so in our artwork, we can also regress. So if I have a 22-year-old young woman coming in drawing at the age of a 5 or 6-year-old, that tells me that there's some emotional regression going on. There's something to dig into there. Okay. So, yeah, so that may or may not be something you notice in your own artwork, but I think that's interesting to be aware of. Again, apologize if I went into too much information there. So, so I mentioned those kind of graphomotor qualities, like the how we make marks on the page, right? So that's going to play into this, and this is the last of the yes, this is going to be the last of the nerdy art therapy information before I go into the actual art exercise, okay? And I think we're good on time. We're about halfway through. Okay, so media dimension variables, you guys are getting like a mini art therapy course here. Most other therapists who are not art therapists don't know this stuff, so you're very informed. So media dimension variables, what that refers to is all of, and this really pertains to you guys and the art task you do. So if you've zoned out on the other stuff, listen to this. This is really going to relate to what you do in your art tasks in the program. So some art media is very fluid, like paint, right? It's fluid, it spreads easy. Watercolor paint is like literally liquid fluid. It's water, with some tint to it. So, well, I mean, I guess it's technically thick water, but it's the most fluid of paint. Then like a thicker acrylic paint would be farther down the spectrum. So all art media can go on the spectrum from very fluid all the way to resistive. And this is the media dimension variable. So more resistive would be like a drawing tool, like a pencil. So like a graphite pencil is going to create more resistance on the page, right? You have to put more energy into it, press hard. So remember when I was talking about like the energy in my body, like anxiety and anger versus depression. So if I'm depressed, it's going to be emotional for me, but probably a lot more rewarding visually to use watercolor paint or a really, really soft oil pastel or a chalk that smears really easily, because there's going to be a bigger bang for my buck. I'm not putting in a lot of energy, but there's a big mark on the page, big color that I can make. Versus if I'm feeling depressed and you give me colored pencils, I'm going to probably color something really small in the corner of the page. I don't really have the energy to do something big, or I'm going to make such light marks it's hard to see, right? And that's okay. But I'm not going to be able to be as expressive and get in my body, right? We're talking about getting in your body with the art materials now. So I'm not going to be able to get in my body and access those feelings as much because like it's going to be harder to engage. And again, for yourself or for the art therapist or for me as your coach, this gives you some information. So um, I give you guys suggestions of art media in sessions 1 through 8. And I really want you to, through those, and I give suggestions based on if I think you should use fluid or resistive, and I'll get to that more in a second of why I do that. But I want you to get acquainted with some of these just really basic art materials, like, how the crayons are different from oil pastels and chalk pastels and paint, I mean, those are the kind of the main things I recommend, markers if you want to. Or pencils, the color pencils if you want to. I want you to get acquainted with really how your body feels when you're engaging with these different materials. So the other point I want to make about fluid versus resistive is that fluid media is more emotive. That's why a minute ago I mentioned it might be kind of emotional for me if I'm depressed to use the watercolor paint, but it's going to be kind of easier physically. So fluid media brings out our emotions, and I've seen this a lot, talk about regression. I just talked about regression a minute ago. As far as regressed behaviors, I remember working with a group of teenagers once, this is when I was in graduate school, and we were painting, I believe they were painting piñatas or something. And these like 16-year-old girls were getting so silly and slap happy and like painting their faces and their hands. And like they were really regressing because they had all these pent up emotions. These were actually teenagers who were in a chemical dependency treatment center, like like not quite inpatient, but it was residential, right? So like it wasn't a hospital, but they were like in a residential program for like 2 months or whatever, like getting intensive chemical dependency, substance abuse treatment. And so there was a lot of emotions that they had been numbing with substances, and it was all coming out when we were painting these piñatas. Like it was crazy. And then, so they were very much in their feelings, and we had to get them back grounded in their bodies at the end of that, which typically in art therapy, you can do that just through cleaning up, through cleaning the brushes, through washing your hands, through wiping down the tables. So in that group session where they were getting crazy with the paint, I had to make sure like, hey, you girl that was like painting on your face, like not only do you need to wash your face, but I want you to come help me clean out the brushes, right? I need you to get grounded and back in your body and like out of your feelings. So using something fluid like paint or like a soft chalk pastel that's going to smear, that's kind of one of the more fluid media as far as drawing materials goes. That's going to help you get in your feelings, which can be good, or it can be not good if you're already in your feelings too much. So if I'm feeling really anxious and pent up and I just really want to be really controlled with the colored pencils because I need control, because that's what we need when we're anxious, right? Then maybe it'd be good for me to push myself a little to smear some chalk and just see how that feels. Maybe it makes me feel too anxious and I need to go back to my pencils, but maybe it's good for me to push myself a little to actually feel my feelings instead of trying to be so controlled and not feeling anything, right? Sometimes when we're anxious, we're like, I'm fine, I don't feel anything. And we're just like stuck in this mode of like everything pent up. But it's good to push ourselves to use some of that more fluid media to get in our feelings. And then once we're in our feelings, through doing that reflective writing process I teach, we're going to kind of pull it back into our cognitive brain and kind of make sense of our feelings, right? So on the other end of the spectrum, if you're already in your feelings, you're like losing it, you're hysterical, crying all the time, just like the girls who needed to get grounded again and clean up the paintbrushes, right? Like you maybe need something more resistive, something you can more easily control. So on days where I'm feeling really emotional, I notice it in the art process, and this is where you can pay attention to yourself. I will notice that I'm feeling really frustrated by paint. I remember this when I was in undergraduate school. I think I've talked about this on here before, but probably on a coaching call. But I remember I would just sort of get lost in the paint. Like I would just feel like I was making mark after mark, and like I couldn't focus. I couldn't really resolve anything visually in the painting. I just kept going. And then what gave me a sense of relief was I would flip my paintbrush over and take the handle and I would make lines in my painting. And my painting professor at the time always said, like, painters don't need lines, like you create the illusion of line with shadow and light, highlight and whatever. But, you know, because she was trying to teach us like the technical, like classic painting skills. But whatever, like you can make lines in your painting, like there's no rules. You can't do that, especially in art therapy or in this coaching program. So I would make lines like with the back of my, like literally digging into the paint to make lines with the handle of my paintbrush. And that helped me feel more controlled. Like I needed a defined shape. I needed more control. So, and that's okay. That helps us, right? So if you're feeling hysterical and emotional all over the place and not grounded, and you're maybe even regressed, you know, you need to do something that can give you a sense of control. And so we can do that with the art media. You can do it with other things in your life. You can like clean the house, that helps, right? But you can do it with the art media. So if you're feeling all over the place emotionally, writing, getting in more in your thinking brain, or just doing more controlled drawing, you know, like the those adult coloring books. You know, I hate it. Some of them say art therapy. They're not art therapy because art therapy is done with an art therapist. It's in a therapy session, but it's therapeutic. Coloring. Some people really like coloring in those tiny shapes in the adult coloring books, and that relieves some anxiety or some overwhelm for them because it's something they can control. Like I can't control anything else in my life, but I can control this, right? And we can do that in unhealthy ways, like through eating disorders. That's usually about control. I can control what I eat. But we can also do it through coloring in a coloring book or through drawing. You know, I can control this. That feels good. And it not only is a metaphor for, hey, if I can control this, I can control other things in my life, but it physically affects our bodies and our brains. It helps us relax. It affects that trauma brain. When we're feeling out of control, we can give ourselves a feeling of control by controlling the media. So I didn't give many examples of the resistive media that's easier to control. So like pencils, you know, crayons to a certain extent, like crayons are more resistive, more easy to control than like oil pastels. I like oil pastels so much because they're kind of in the middle. They're a little messy, a little fluid, but you can also control it better than like watercolor paint or chalk, right? Crayons, markers are somewhere kind of in the middle too, because there's a little fluidity, but they're easy to control, especially if it's like a fine tip marker. Pencils are more resistive. If you think about 3D material, like collage, gluing things together, or hammering two pieces of wood together, that's super resistive, right? And 3D fluid material would be like really wet clay, versus like an oily modeling clay is more resistive. You see what I'm talking about here? So there's this spectrum, and we can pay attention to how our body feels and how our emotions feel when engaging with these different materials, and learn to kind of gravitate towards what feels best to us. And the reason I'm going into this now is this is the advanced sessions. And so this is after you've already had some experience with this basic process. And I really want you to be developing your own voice and your own kind of intuition as an artist. We're all artists here, whether you feel like you are or not. You can make marks on a page, you're an artist. This is where you're developing your own intuition as an artist, and what you need in this therapeutic art practice. So I'd love to answer more questions about this if you have it, if you have questions as you go through your art tasks. I love talking about this, and this is something that I have grown to be very intuitive with. And when I first learned about it in art therapy school, it was the hugest aha moment, like I've ever, one of the hugest aha moments of my life, because it made sense to me. Like I said, in undergraduate school, I would just feel lost in the paint and have to go in and make lines. So when I learned about this, I was like, oh, this is what it was. I was feeling, you know, overwhelmed and anxious. I needed some control. So this can really inform our art making practice. Now, when I look at my kind of range of art materials and think about what I want to use on any particular day, I'm really able to hone in on what I need, what my body needs. And throughout the art process too, I'll combine non-traditional materials. I'll go draw on top of a painting or paint on top of an oil pastel drawing if I feel like that's what I need, because I'm paying attention to my body and my feelings and how they're responding to the media. So, and I'll touch quickly here on, because I kind of already explained it in a roundabout way. So a top-down approach or a bottom-up approach when we think about how to approach addressing trauma with art. art therapy. So a top-down approach is we're starting in our thinking brain and getting into our feeling brain. So that's where we're starting with something more resistive, or we're starting with like writing. And I'm going to get to that in our art activity here in a moment. Where we start with like thinking of a feeling. Well, like in your session 1, if you've done session 1 of those first 8 core sessions, session 1 where I have you identify like a color to go with a feeling, you know, so like I'm feeling sad, this is the color that goes with sad. I'm feeling angry, this is the color that goes with angry. So that's a very cognitive process, and that's what we're going to do here in a minute too. I'm going to be an example of both a top-down and a bottom-up approach with this body signals art task. Okay, so we're starting with our thinking brain and getting into our feelings. So you start with wherever you are, you know, and as an art therapist, I start with wherever the client is. So if they are if they're stuck in their thinking brain and not accessing their emotions, we start with their thinking brain, right? We start with the cognitive, and then we move into accessing their feelings through the art media. And again, you can do this yourself when you're working. You can become acquainted with kind of where you are emotionally and what you need. So a bottom-up approach is the opposite, what I explained when I was talking about the media, where you're really in your feelings and you need to like rein it in and kind of make sense of it and get into your cognitive brain. And so that's where we might just start with just spontaneous fluid art making, just paint your heart out, splatter it all over the wall, whatever you need to do. And then we're going to do the writing, we're going to do some reflection, we're going to talk it out and bring you back into your thinking brain. But because you were in your feeling brain, that's where you know, that's where you have to meet yourself, right? Because that's where you are. Like you can't just say, okay, I'm going to sit down and think this through. Like, no, you're emotional. You have that energy again stored in your body, whatever that emotion that's coming up for you, whether it's just like a normal, you know, you're feeling stressed because of your workload at work, or whether you experience a trauma trigger that's made you like super like weeping and hysterical. You know, you can't just sit down and be like, okay, I'm going to think this through rationally. No, you're in your emotions, right? So you need to do something to meet yourself there, but also draw yourself towards that thinking brain. And the same with the top down. If you're stuck in your thoughts and you're just rigid and like can't access your body and your emotions, we start with the thinking, because we can't just be like, oh, feel, be expressive. Like if you're not there, you're not there. We start with the thinking and like move you into the more emotive. Okay. So the body signals art exercise. I'm going to give you 2 examples of how to do this. One is the traditional way that like I've been taught, that I've always done with most clients, which is starting in the thinking brain. And then another one that I've started doing more recently, which I think is really effective, to start in the feeling brain. Okay. And the purpose here, the rationale, is to connect your thinking brain and your feeling brain, because either end of the spectrum that you're at, we want the 2 to connect. So we want the 2 to talk to each other, right? Okay. So materials for this, a piece of drawing paper. I try to do it like kind of like the long rectangular piece, like 9 by 17-ish. Or you could do really large butcher paper if you have that. Most of you probably don't have that at home, but that's great. Or you could do this. I just found this at home. It's my daughter's. It's a roll paper that's like this size. So that's maybe 17. I don't know. But this is like, you know, some kids art brands, like you can order it on Amazon, and it's a roll. So the benefit of this, it's not super wide, but you can roll it out as long as you want. And that was my idea with suggesting maybe using butcher paper, is you can make this sort of life size, like as big as your body, because we're going to be talking about the body. Okay. So if you have something you can roll out that's long, at least as tall as you are, even if it's not as wide, that can be helpful. It doesn't have to be, though. I'm going to demonstrate it here on just a small piece of paper, and I'll stop my screen share in a moment to demonstrate. You're going to want like a black marker or crayon, something dark, because we're going to do an outline first. And then crayons, oil pastels, or chalk pastels. So my crayons are my suggestion that are a little more resistive. Oil pastels are a little more fluid, and chalk pastels are a little more fluid after that. So I want you to pay attention to what your body feels like you need based on what I shared about the resistive or fluid media. You know, and a good way to do this is to kind of just go with your gut, which we'll get to that. So the so the top-down approach, this is what to do. And I'll also, like I did with the other advanced sessions, I will make a PDF with directions. That's not these slides. And I'll maybe go into a little more in-depth written there if you're just wanting to follow the written directions. So first, you're going to draw a body outline as big as you can fit on the page. So I'm going to read through this, and then I'm going to just show it to you too, okay? I'll stop the screen share and show you. But so you're going to draw a body outline, kind of like a gingerbread person. You don't want it to be a stick figure. You want it to have some girth because we're going to be coloring on the inside of it, okay? And so again, this is the top down. We're starting in our thinking brain. So similar to how I have you all start the scribble drawing in session 1, you're going to choose at least 3 emotions that you feel on a regular basis and assign a color to each one of those emotions. And it's helpful if you make sort of a key on the side of your paper so you remember which color goes with which emotion. And again, I'm going to show you that in a second. And then you're going to fill in the area of the body where you feel each of these emotions, okay? You may find it helpful to do a body scan first. So to just stop and make yourself sort of breathe and you know, just from the head down or feet up, whatever. Just scan through and pay attention to how your body feels. Like, is there stiffness in your shoulders? Is there like a heavy feeling in your gut? You know, is there a lightness in your hips? Is there whatever, you know, pay attention to how you're feeling physically before you do this might be helpful. Okay, so I'm going to show you how simple this can be. I'll stop my screen share in just a second to show you. I'm drawing my like outline of my person. And I'm doing this on just like a kind of 9x12 drawing paper, so you can certainly do that. But I think the bigger, the better. Okay, here, let's stop the screen share. Okay. So here you go. Here's my body outline. If you want to make it look more like a womanly shape or how your body's shaped, feel free to get as specific as you want with that. Just your generic person. I did it with a black marker, so it's a heavy outline that I can see. And then I've got just my regular crayons here. I've got my daughter's art materials because I'm at home tonight and didn't think about bringing stuff from the studio. So I'm going to pick my emotion colors, okay? So again, we're starting in our thinking brain. I'm going to pick my colors, assign them my feelings. So I'm going to choose anxiety. I'm going to choose joy. Hopefully this shows up on the screen. And I'm going to choose, let's see, depression or sadness, okay? So you can either I'll just write sad because it's easier. Joy and anxiety. So you can either make a cute little key like this with like a circle or square next to the emotion word and fill in that circle or square with the color that you want to assign. There's no right or wrong. So you can do that like this. Or what I've been doing more recently, which is kind of hard with a light color like yellow, but you can just take that color and write that emotion word on the paper, okay? So if you want to look like a cute little key, you can, or you can just take that, I took that orange crayon and just wrote the word anxiety, okay? So either way you want to do it, make a little key so you know what colors you have, leave those colors out of the crayon box or whatever. And so I'm going to think about where I feel these in my body, and I'm going to color it in. So this can be coloring in solid. It can be a scribble. I suggest kind of doing some lines because that's where you're going to kind of show some of the energy. Some people just color it in kind of solid. I'm going to try to do this backwards. So I feel a heaviness in my shoulders when I'm sad or depressed. So I'm going to color blue on my shoulders. And you guys know I like to do just kind of big, rough, sort of primitive scribbles. It can go outside of the body too some. Like if that just feels like a really big feeling that I have, then that could just keep going, okay? It's not like you have to color in the lines. This is just this area of the body where I feel this heaviness. And I'm going to say it's there, and I'm going to say in my head, because again, with that sort of fatigue, heavy trauma feeling, when I am feeling that, I'm feeling sad and depressed, and there's a heaviness in my head and in my body. It kind of washes down some. I'll make some lines kind of going down the body too with that blue. I made some lines going down there and the heaviness in the head. Okay, mostly I feel it though kind of on my shoulders. So that'll be an example of my sad or depressed. And that did have energy to it, which is interesting. And I just did that without thinking about it. So that'd be something in my reflective writing that might surprise me. You know, there was some energy to that. Like, what was that about? Because I tend to talk about low energy when I'm sad or depressed, but there was really some energy in that drawing. It could just be I have energy now, or it could be there's something to that, to some energy in the sadness and that heavy feeling too. So anxiety, I feel in my stomach, and it's kind of a spiky energetic, and I feel like a tingling in my hands or my arms. So there you go. So I just scribbled in there. And then joy, I think I kind of feel that all over. So you can show all over by just sort of coloring over or around the things that were already there. I feel like a lightness in my body. So it's kind of the same places as the blue for sad, but it's yellow. So I'm going to kind of do it in the same places and all over. So this yellow is kind of all over my shoulders too, definitely in my head. So there's a lightness in my head and shoulders versus the heaviness when the blue is there. If you like to do things more neatly than this, some people like to show an all over feeling, by doing an outline around the body in that color. So that's one way you can show it if you've already got kind of the inside filled in. So there's not really a lot of wrong way to do this. Don't get into making it look like you like drawing a face and clothes and stuff. That's not what this is about. I know this can end up also looking like a weird sort of aura picture, like this is my aura, but that's not what it's meant to be either. I mean, it can be if you want to, but we're just showing kind of where we feel that in our body. And so this is a chance to we're in our thinking brains naming these feelings, but when we're doing the drawing, we're getting into our body, into our emotions. And if you're using a more fluid media, that's going to be more so, like if you're using the chalk. And so even if you're starting in your thinking brain, if you use the chalk, that's going to get you maybe more emotive, more in your feeling, more into your feelings, right? Even if you're starting in your thinking brain. But either way, this is going to get you in your feelings. And really, I mean, that's how it is with all of these art therapy interventions they're not, that's fine. My art therapy talk just came out. There are all of these art tasks because we're not doing art therapy here. We're doing art tasks, right? Because this isn't in a therapy session, but these are all art tasks that I would feel comfortable assigning to an art therapy client for homework to do on their own. So I'm not giving you any directions that are, that I wouldn't feel comfortable with a client doing on their own. Okay. So that is the example of how to do that, starting with the thinking brain. Okay. I'm going to go back to my screen share for a minute. We'll come back in a second to show this. Okay, there we go. I'm proud of myself for doing my screen shares effectively. Okay, so that's the top down, and then bottom up. So we're going to do the same thing. I'm going to make a body outline. I'll go ahead and do that now, as big as you can fit on the page. Now, I want to stop here and explain why, as I draw the outline, I'll explain why I think if you can do it big, kind of life size, then do that. Because now think about how we're talking about engaging our bodies with the materials. Imagine standing next to a wall with a big piece of butcher paper as big, as wide and tall as your body taped up on the wall. And imagine that experience of scribbling like I just showed you, okay? So that is like that paper, that body outline is like mirroring your body. So that's much more effective with getting in your body, okay? And again, especially if you're using a more fluid drawing material like the chalk, but either way, even if you're using crayons, even if you were trying to use pencils, in that colored pencils, you're still going to be engaging your body more, like physically engaging your body. So I know most people don't have huge rolls of butcher paper, but that's why I gave the example of this kind of paper. You can get this at a craft store or order on Amazon or whatever. It's like for kids or, it's not like high level artist grade paper here at all. It's thin, but you can make it long. You could even, what you could do is do 2 rolls of this together, like find a wall somewhere, roll it down as tall as you are, put another sheet next to it and tape it together so it's wider. That's a good, I'm glad I thought of that. It's a good suggestion, because you're going to have a different physical experience doing this art task if you can really make your body big, and it's like you're mirroring that body outline that you drew on the paper. Okay, so for this, if we're starting in our feelings, and this is what I've started doing lately with clients, and it's been really effective with my in-person art therapy clients. So look at your crayons or oil pastels or your chalk. I forgot to add in chalk in there, whatever you've chosen to work with. Pick a color that stands out to you. So you're just going with your gut. So you're not thinking anxiety. Orange is my color for anxiety. You're just like, oh, that maroon color, like it just is like calling to me. I'm going to pick it. Okay. So you're just going with it. You're not really thinking because you're in your feelings, right? You're just going with what feels good. If you can't identify when you sit down to do this, if you're more in your feeling brain or your thinking brain, just pick one of these. It doesn't matter. You can do both of them. Okay. Pick what color stands out with you. Go with your gut. What color feels right. You're going to just begin filling in the body outline with lines, shapes, and colors like we did before, but you're not aiming to capture necessarily how your body feels in this moment. You're not aiming to illustrate a certain emotion. You're not pressuring yourself. You're just going to trust your intuition and draw. Okay. All right. So this will be easy to demonstrate. Literally, did I stop the share? No. Okay. So literally I did another body outline. This one looks even worse as far as, okay, red, or this is pink sherbet, just a little more pink. I want something that's going to show up. Red has been standing out to me a lot lately. So if I'm just in one of my red moods, which has happened lately, I always just hate red. I've said that in other videos. But now I've found it's representing kind of some deeper pain I need to tap into. So I've just been doing a lot of artwork with red because it just calls out to me. It's like it needs to be heard. So man, if I just feel like this whole body needs to be red right now, and this feels good to me, like I'm looking at this red, like I literally just started coloring. And so when you're doing this, if you're doing this approach, think about how your body's feeling, right? You could do the body scan ahead of time, right? You could do the body scan, but you're just intuitively like, oh, this is how I feel. Okay. You're just filling it in with no judgment. I'm doing some red all over, but I don't feel like I want to do solid red. Maybe I think the face needs to be solid red right now, and maybe the shoulders. Oh, maybe some of my stomach. Okay. So, I mean, literally that's just what it felt like. And I'm talking it out loud, but that's what I wanted to do. So colored in like that. Again, I tend to scribble kind of big, rough scribbles like this. If that's not your style, that's fine. This is just how I do it. And then the pink is standing out to me. That's close to the red, but different. Carnation pink, or maybe I'll go with this. You can sometimes like to test a crayon on the paper just to see, because you can't always tell by looking at it. Okay, so the carnation pink is going to work for me. And I really think that I just kind of want to fill it in solid, the rest of it pink. So the white spaces that are showing kind of behind my red scribbles, I'm just, and this is just live, me just doing this. Like I'm not trying to make it a particular way for you all, okay? So this is not prescriptive. This is not the way you have to do it. This is what came to me. I think I'm only going to do these 2 colors. Okay. I've done this with clients with the large butcher paper, like the equivalent of if you put 2 of those roll papers together, and with the chalk and working on it on the wall. And there was a woman I did this with that she prefers to talk during the sessions. So she, to me, seemed a little distracted. Like it's not based on how I would want to work. She was just talking about, things going on in her life, whatever, while she drew. And for her, that helped her to be more in her feelings because she wasn't focused on like, oh, what does this color mean? What does that color mean? She was just going with it. So you might find you need kind of a distraction in the room in order to fully get in your feelings and go with your gut and not overanalyze your choices. So that's a suggestion for you. For me, I would be too distracted if I did that. I need to just focus on the art. But that's just a thought. If you're more kind of in the thinking brain, but you're wanting to try this more intuitive approach, Maybe you need something else going on to distract you from like thinking too much about it. And so with this, I think, and I didn't write this on the directions, sorry. I think, so I knew when I picked up the red that that's the pain, because that's something that's been been occurring in my artwork a lot lately. And then I was just trying to think. So I just wrote down pain because I already knew that when I picked the red. And right now, like real time, I'm trying to decide what that pink meant, because this is real. Like I just did this. My brain wanted the pink. And I'm having trouble coming up with one word. I think it's I'm going to write content. That is the word that came to me. And I knew it was positive, but it's where I feel like the pain sort of is bringing some good to me, like it's helpful for me. And that's something I've talked about before. It's not the time to get into it, but yeah, I think content, like it's some good force along with the red. And so so pain and content, I wrote in those two colors as my key. Okay. But I did it after the fact. You could do it after the reflective writing. So, so you might not know what it is until you do your reflective writing. You might not be able to name the feeling. I did just then. It came to me. But you can wait. Now I kind of want to do some writing about this. This is interesting. So, so yeah, spend some time engaging in the same reflective writing process that we do. So first of all, you could just start out by describing kind of the colors you see, describing the physical shape, what the experience was like for you, just whatever thoughts are coming out. But then I really want you to move into that dialogue with your artwork. So, yeah, you can think about if this accurately reflects how you feel or not. But then in that dialogue is where, again, we talk about trauma treatments that access both parts of your brain, like EMDR. So this isn't the same as EMDR, but it's similar to other trauma treatments like that, where you are engaging with different parts of your brain, with like the subconscious and the conscious, with the right and left sides, right? So if the right side, and I'm no neurologist or, but what was the other word I was looking for? Anyway, I'm not a brain expert, but so the right brain, that creative part of our brain, is activated engaging in these art materials, whether you're using the more resistive, like whether you use the crayons for this or you use the soft chalk pastels. I mean, there's some difference there, but still you're engaging this creative part of your brain, this different part of you, and that helps you tap into your emotions, tap into the trauma that's stored in your body, in your nervous system, all the subconscious stuff that's there that we can't quite make sense of. Like, I don't know why I'm so triggered by this thing over and over again. It's that stuff stored in your body. And so that doing the drawing, doing the art helps you access that. And I would argue, painting would help you access that more than doing the therapeutic, coloring books. But I mean, that is therapeutic in a different way. But if we're talking about accessing stuff, I think, accessing those emotions and everything, I think the fluid media is more helpful. But that's not to say that, like I said, you pay attention to where you are and what you need. But so either way, we're activating this right side of our brain, this creative part. And then through the writing, we're tapping into that. Like when we're in this moment, this is important. Like it's important to do the reflective writing right after you do the art, because your brain is in this state. Like I mentioned, the teenage girl who was like regressing and painting on her face, like she was in this place where she was like tapped into some feelings, into some regressed feelings. So if I had been able to, if that wasn't like a group art therapy experience, it was in the evening too. I remember it was dark outside, we were painting piñatas, if it hadn't been that experience, that situation, if it was more of a contained individual therapy situation where we had a long time to process it, we could have really dug into that and tapped into what memories, what feelings was she kind of experiencing in her body, when she was regressing that much with the paint, right? She was tapped into that emotive part of her, which is close to the trauma, right? So, So when we're in that state where that's kind of, or those emotions are kind of activated, if you will, um, that's a good time to bring in the writing. And so that's why we go with just the free association writing, like whatever comes to your mind, because those things that don't seem to make sense, that is your brain is opened up and it's ready to tell you something. So you want to tap into it while it's opened up after you do the art. Okay, I hope that makes sense. I get so excited about this. Like this is the core root of like why we do this process with the art and the writing. So you're sort of opened up, these emotions are activated. It could activate some trauma. It could be upsetting, like with that girl with the painting, we could have dug into some stuff that was too much. It could have been too big, the trauma that would come up if we had processed that more deeply. So, be careful with it. But like, so if you feel too overwhelmed, like stop, basically is what I'm saying. But so that's opened up, the emotions and possibly the trauma are activated. So dig into it, write whatever comes out because your brain's telling you stuff. And then as you keep writing, it may or may not make more and more sense as you're writing, but then after you stop, when you go back and read it, it can make sense because you're gradually kind of getting more into your thinking brain again as you're writing. You have more space, more distance. Maybe you need to go wash your hands and clean up, like I said, have a grounding experience, and then come back and read what you wrote. And it's so interesting because you've put it into words, right? You've taken it out of that. Just now you saw me do that. I did the intuitive, just I needed the red, the paint. I don't know what the pink is, but it feels like it needs to be solid and really fill in the rest of the body. And then I stopped and I pulled that into my cognitive brain and thought, okay, well, I knew that was the pain, but what is this? It's content. Oh, that's interesting. How does that go with the pain? It pulled it out. But when I first went with that pink, I was just going with it. That's what my emotions were telling me. It's what my subconscious brain was telling me to do. And then when you saw me think about that and choose the word content, that's my brain making sense of that. And if I go and journal right now about that, I'm going to get some insight into that content feeling and how it works with the pain and how the pain is beneficial to me right now to process it, all those things. So ask your drawing questions. Ask it questions, whatever question pops in your mind, even if it sounds ridiculous, even if the order of the words doesn't fully make sense, like write it down, then write whatever comes to your mind as an answer. And this is where we're making that connection between the different parts of our brain. This is where we can make a further, mind-body connection, because you have engaged your body in this process. And again, be mindful, it's kind of a warning, just like my story with the yoga, where that got me kind of deeper into my trauma reaction in my body. I felt kind of worse after doing the yoga because I wasn't fully in my body before I started. So if this brings up painful things for you, reach out to me for sure. But also like I'll probably be quick to tell you to process it with a therapist. Okay. So if you're doing these art tasks and it's bringing up a lot of deep emotions, or just physical feelings, like I said, like my trauma heaviness in my body, or you just can't get grounded and back kind of in your thinking brain, you're staying really emotional, or if it's bringing up literal traumatic memories for you, which is not my goal here, it's not my goal. But if that happens, just be aware that could happen, is what I'm trying to say. Be aware that can happen because we're accessing these different parts of our brain. So if that happens to you, it's normal, you're okay. It doesn't mean that you are like, you've backtracked so much. Like, I thought I made all this progress. Why do I feel so triggered and so emotional right now? Like, it's okay. It's natural. It's normal. Oftentimes I felt worse after therapy sessions, after doing EMDR, and I had to go back to my therapist and we came up with a way to sort of ground me and put me in a happy place before I left her office. Because the EMDR made me feel worse in the moment, even though overall it was beneficial. Okay. So if this brings up stuff for you, it's uncomfortable physically, emotionally, or both, or through, traumatic memories coming up, know that that's normal and that's okay. You're not broken. You haven't like digressed back to an earlier stage of healing. That's normal. I'm not expecting that to happen, but if it does happen, like that's in the range of normal things that can happen when you do this. So reach out to me for sure. I can talk it through with you. I'm always available for one-on-one coaching calls. It is an extra cost. I'm charging you guys 90 per session, per hour, which is less than my individual therapy rate. But yeah, you can schedule a one-on-one coaching session with me to process that more, and I can kind of explain what's happened or help you with it. But also, we can't do therapy like that. I'm in a coaching role here, so I am going to encourage you to process that more with a therapist in person or telehealth, whatever you choose. Um, but you and I can process that further for sure, either on a coaching call or you can just send me a message to talk it through a little bit. But I will encourage you to see a therapist if that's kind of a recurring thing for you. Okay. I didn't expect to give that warning, but I'm kind of glad I did. I mean, that's really realistic that this can bring up some stuff. I mean, yeah, read the Body Keeps the Score, the book. There's so much held in our bodies, and we're bringing that up here with these art tasks. But that's a good thing ultimately, to be connecting these different parts of our brain, to be connecting our body to our brain, to be integrating it all. Our goal is that integration, right? We want to integrate this so we're not having to like dissociate and go in and out of different parts of ourselves. We want to be an integrated whole person that can safely house this trauma, release it, whatever we need to do, and to not feel threatened by it and not go into fight or flight, when we're triggered. So all right. Thank you all so much. This went a little long. Last time went a little short. This was a lot of information. I really enjoyed sharing it. Let me know if this was helpful for you. And I can always go into more, stop my screen share. I can go into more detail about some of these things in a coaching call if you need a follow-up about this. Okay. Feel free to reach out and ask me. All right. Thank you so much. I will see you on the next coaching call, and we'll be doing another teaching, another training next month. I think my topic I'm toying with, let me know if you think this would be interesting, is radical self-care. The idea of radical self-care, which really isn't radical, but it seems radical to us. I think I want to talk about the importance of some kind of daily practice of self-care, right? The stuff we're doing here, most of you aren't doing this daily because these are big art tasks that take a while to do and all of the writing, but it's important to have something daily. And that seems radical to us. How dare I take, 10, 20, 30 minutes a day for some reflection, some kind of self-care. But I think I may want to get into that next time, radical self-care, possibly for the September training, live training. So, all right, I will have the PDF directions for this and the recording of this, and also the slides on a separate file, all uploaded to the membership site for the Redefine process, probably by sometime early next week. Okay, it'll take me a few days to get all that together, but I'll have that uploaded for you as the advanced session 3 if you want to go back over it. All right, thanks.